Hi, Dr. Sheldon. This is, what day are we on? April 9th, Wednesday. It's 2 weeks tomorrow since my proximal Tib-Fib surgery done in Missouri. I'm back. You're seeing me for the first time. Just taking off the leg brace. And we're going to rejoice that we don't have a fibula bone from hell anymore, right?
That's the plan.
That's the plan. It was a great trip, and I'm glad to be back home. Dr. Main and his staff there in Missouri took great care of me. And but I owe a lot to you, Dr. Sheldon, because I asked Dr. Main, how does somebody like me with an out-of-state patient, try to figure out if they got a fibula problem if you're not getting another medical doctor that's really diagnosing you correctly? And so I asked him, the video, is good for documenting things. Obviously, it's ultimately up to Dr. Main for his hands-on diagnosis, and he's adamant about good quality hands-on diagnosis and, of course, subjective patient history. Because I asked him, well, what differentiates him between other orthopedic surgeons? And he just really believes in that good hands-on diagnostic, and I'm so grateful because it isn't a diagnosis of, it's a diagnosis of exclusion. You just don't see it.
Yeah.
I don't even see. They took pre-surgical x-rays, and I don't even think there was anything to really be seen. They did see that I was falling medially, pronating on my ankle on my x-rays. And so there was a consideration that he was going to do a second Arthrex TightRope at my ankle, which he did do, and he made that decision intraoperatively. We discussed it in the pre-surgical waiting room. But he wanted to know after he tightened down here if there was still any instability down here, he would put one through, and he did do one Arthrex TightRope in the ankle. But anyhow, I just wrapped it up. Last night was the first night I actually slept with nothing wrapped on it. It felt good. It's just we're getting this warm weather now here in Idaho, isn't it great?
Yeah.
Oh, and I just don't want to sleep. It gets kind of warm and itchy. But I was at Dr. P.Z. Pierce, Champion Sports Medicine doctor, yesterday, and he took the steri strips off. The incision looks great, and did one physical therapy yesterday. I think it's, in my opinion, one of the muscles we're dealing the worst with right now that Mark found yesterday was the soleus, deep in the soleus under there, having a lot of trigger points and real tightness, and he did kind of like a pin and stretch type of maneuver with me as he was working the tissue in my leg, because it's a real spot, but it was hard to tell what the heck was going on until after you got the bone stop moving.
Yeah, right.
Then you can figure out which muscles need rehabbing, so that's kind of where it's at. So there you go, Dr. Sheldon. You can
Let's check this out.
And if you want to, on the video, want to come closer so you can just get up and want you to be able to get a picture of it.
Oh yeah.
No more fibula.
Yeah. Nope. No, and the thing that was crazy about her fibula was when we could adjust it, come back within a couple days, and we weren't getting anywhere on. They were loud audibles, some of the biggest fibula adjustments I've had, and typically on a fibula adjustment, once you adjust that, they have a pretty high rate of stability, not something we have to come back and do multiple times. And we come adjust hers and come back, get a really loud audible. And I could grab that thing and just see it go, from A to P, just a lot of glide in it, even this. In the past, we would be able to see that move. So from that standpoint, obviously, that looks great.
They'll just let you go. Yeah, it's just a little red. But. And then the ankle, there's where he did the Arthrex. Anyhow.
And then this lower distal end, was showing some wear and tear a little bit on MRI.
Yeah,
and
it
it just was seeing the after effects of that proximal end not moving properly, and so
Yeah,
But-
I just have soreness, right? I just have
Right.
soreness right there, which I'm bruised, which is all normal. It's only 2 weeks tomorrow.
Yeah.
I mean, it's doing great. I mean, 100 bar none, 100% less pain than last year's one.
Yeah.
And you know what I really believe the difference is? When we did the one last year, I still had the chronic problem with
Yeah.
the talus. And all the muscles that were probably trying to stabilize my talus last year were still spasming after I had fixed the proximal end. And then I had all that chronic spasm and pain over the nerves, and it was just terrible. I don't have any nerve pain with this one.
Mhm.
He did decompress the common perennial nerve,
Yeah.
that's normal to do that while he's in there. And he did, there's called hemocyte, I can't pronounce the exact word. It's, the unofficial word would be a PRP injection.
Mhm.
So he did do that after it was all sealed, he
Yeah.
did a PRP injection into the site for the tissue, which, like I said, the only really the worst post-operative pain was right here. Like it feels like somebody beat your shin. It's just right here because the fixations come through here, and they adhere to the tibia. And I'm just saying, you just feel like you're beat, like somebody. That's all the way I can describe it. And then it did feel like I had like a rope around my ankle, and then obviously I have a rope in my ankle.
Yeah.
Other than that, I mean, you can see I've been working on my, he said I can move my leg in any way, I'm getting my range of motion, I did the CPM machine, range of motion, move it, ankle pumps, quad sets for contracting the quad. I'm doing all this like I'm supposed to, and then doing the soft tissue work, to try to free up the adhesions.
Yeah.
So that's kind of my 2-week update. Thank you very much.